So, your child has type 1 diabetes. Here's what you need to know. Let's watch an informational video on living with type 1 diabetes.
Welcome to Diabetes Done Well. In this informational video, we will be discussing a variety of topics that will help you better understand your role in keeping your child with type 1 diabetes healthy. We will cover a variety of topics, including maintaining a healthy diet, the correct ways to utilize a glucometer and administer insulin, the importance of physical activity, how to recognize severity of symptoms of type 1 diabetes, and the importance of compliance in these strategies. Let's begin by talking about nutrition.
Hey guys, let's talk a little bit about diet.
So I know managing your diet while you have diabetes can seem a little tricky, but we're here to talk about some ways to make it a little bit easier.
Let's head into the dining common and see what they have in there.
Hey guys, we're back. So one of the key things to remember when managing your diet while you have diabetes is to make sure you have a balanced, healthy diet.
Yeah, and one of the tools you can use is found at the American Diabetic Association. We have this little plate here to help us figure out what we need to eat. So
we've got our plate of food that we just got from the dining common.
And as you can see, half of your plate should be non-starchy vegetables. And then about a quarter of your food should be protein. We have some good looking
Nice turkey here.
And then about another quarter, maybe less, should be carbohydrates. So we got some whole grain toast and some oranges. So we talked a little bit about what your plate should look like, but here's some general guidelines on foods that you should limit and avoid, and some healthy snack ideas at the end. So you should try to avoid foods that contain high cholesterol, like cheese and full-fat yogurt. And also you should try to avoid simple carbs like white bread and pasta.
So some other foods you should try to avoid or limit are sodium, salty foods, and sugary foods. Remember, you don't have to totally eliminate these things from your diet. Just make sure you got a good balance going on.
Yeah, and some ideas for healthy snacks can include carrots and hummus, cucumbers, popcorn, some low-fat yogurt.
Sounds delicious.
Yeah. Just remember, the key to a diabetes diet is all about balance.
Here's everything you need to know about glucometers and insulin administration. Always be sure to cleanse the skin before pricking to check the blood sugar. A glucometer is the best way to know how much insulin to administer to your child. After cleansing the skin, insert the strip into the glucometer and turn it on. Then uncap your needle and prick the skin. Simply press down and the needle will pop out. Before drawing up the blood, wipe away the first drop and gently squeeze the skin until a second drop forms. Once the strip sucks up this drop of blood, it will only take a second for it to monitor your child's blood sugar level, and then you can administer insulin. The most common method of injecting insulin into your child is through a subcutaneous injection into the abdomen, always being sure to rotate sites to prevent scar tissue formation. It is also very important to know which kind of insulin you'll be using: long-acting, short-acting, cloudy, clear, or mixed. For this demonstration, we'll be using mixed, which is both cloudy and clear combined. When making mixed insulin, always be sure to roll the cloudy insulin, or NPH, before using, and know how many units of each type you'll be using. For example, if I need 5 units of cloudy insulin and 7 units of clear insulin, I will inject 5 units of air into the cloudy bottle and 7 units of air into the clear bottle. I would then draw up 7 units of clear insulin and 5 units of cloudy insulin before administering it to my child. As always, be sure to clean the skin and the insulin bottles before drawing up the insulin and injecting it. To administer, simply squeeze the clean part of the abdomen and insert the needle. Once the insulin has been injected, you can pull out the needle as you release the skin and push forward the safety on the needle. Now you are ready to confidently step forward with insulin administration.
Now you might be asking yourself, are there any activities that I can involve my child with type 1 diabetes in? Absolutely. Exercise is a great way to improve your child's physical health as well as their overall well-being. Some physical effects that you can improve with exercise include improved cardiovascular health, which will help with circulation. It can decrease the child's blood pressure and cholesterol levels, which will help with vascular complications along the way. And then it can also decrease weight and fat accumulation, which can help decrease some of the metabolic effects of diabetes. It can also increase the insulin sensitivity in your body, which will just help the insulin work better. Exercise can also help improve your child's mood and energy, which can help with school, making friends, just random social things that they might encounter. Something to keep in mind is that physical activity can affect your child's sugar levels, so it's a good idea to have them eat about 15 grams of carbohydrates before they go and start physical activity to prevent hypoglycemia, and then also bring along with you a pack of emergency things like juice or something else to keep the blood sugar to a normal level. It's also a good idea to keep a journal with different activities and blood sugars, just to get a history and know better for next time how different activities will affect their blood sugar. If your child suffers from retinopathy, neuropathy, or other kidney disease, anything that might be a complication of type 1 diabetes, it's a good idea to keep it a little slower, so maybe walking instead of running and things like that. Most importantly, just have fun with it. You can bike with your child, you can go running, you can even make TikTok dances, just something silly and fun that will keep them engaged with the activity.
Adverse effects of type 1 diabetes include hyperglycemia and hypoglycemia. Hyperglycemia can have mild symptoms, later symptoms, and emergent symptoms. Mild symptoms include increased thirst, frequent urinations, headaches, blurry vision, and fatigue. Later symptoms include nausea, vomiting, shortness of breath, dry mouth, weakness, confusion, coma, and abdominal pains. Emergent symptoms, which you should contact your provider about, are diabetic ketoacidosis, where ketones are present and your glucose levels are above 240, and the person has fruity smelling breath. Another emergent symptom is hyperglycemic hyperosmolar state. This is when your glucose levels are above 600. Symptoms of this can be excess thirst, excessive dry mouth, excessive urination, warm, dry skin, fever, drowsiness, confusion, and hallucinations. It is important that you contact 911 if you are sick and cannot keep food or fluids down, or if your glucose levels are consistently above 240. Another adverse side effect of type 1 diabetes is hypoglycemia or low blood sugar. Symptoms of this can be confusion, dizziness, nausea, feeling hungry, shaky or anxious, rapid heartbeat, sweating, chills or clammy skin, weakness, tiredness, headaches, or loss of weight. More severe symptoms that can become emergent are seizures, coma, or loss of consciousness. It is important that you contact your provider if you have a diabetic emergency, because at this point, at-home treatment is probably not going to help, and delaying treatment can cause permanent damage or death. Symptoms include chest pain, difficulty breathing, fever, severe headache or weakness, seizures, loss of consciousness, shaking or confusions, or the fruity smelling breath.
And now we have some instructions for you as a parent, or you can give instructions to a teacher or the caregiver of the child with diabetes. It is important that you create a list of a bundle of instructions to give out to anybody taking care of your kid about important information of your child diagnosis. For example, you can make a list of medications, schedule meals, and explain important symptoms to watch out for if an episode of low blood sugar happens. It is important to make a schedule of medications and food at the times that it needs to be done, or like eaten or taken. Make sure that your child has all the supplies if he or she needs to use a glucometer, and you have to be consistent with the times for food and medications.
You also want them to be able to know what they need to do on their own when they go off to a caregiver or school. So you want them to know how to contact a teacher or whoever's in charge of them when they're having their low blood sugar episodes. And you also want them to be able to check their own blood sugar as well. You also want to have snacks and fluids available, like in their book bag or wherever they have like a bag to carry their stuff. And then you also want them to be able to wear a medical bracelet because that lets other people know that they have diabetes type 1. And then you also want to teach them to be aware of what they're eating or what they're about to eat. If they're buying lunch, you want them to know what they should eat for lunch.
It is also important that just in case a low blood sugar episode happens, that you know the symptoms and do not leave the child alone. So if they go to school, you need to explain to the teacher how to recognize it, which is what she said with the bracelet, with the medical bracelet, and do not leave the child alone, just in case if that low blood sugar episode happened.
And then you also want to teach the importance of watching their skin because those with diabetes can get wounds and they are very slow at healing. So you also, with that, want to teach them to have closed-toed shoes. It's important for you and your child to know how to manage and comply with this disease because the complications can be significant.
Remember the treatments for it. You have to comply to a good diet, have fun with exercise and physical activities with your child, and also doing the medication administration correctly.
We've been through a lot of information. Do you have any questions?
I don't. I'm so glad that I learned more about my child's condition.
All right.